Dr. Daniels, thanks so much for joining us. Start really basic, if we can. What is sepsis?
Sepsis is the way the body responds to an infection. So it's always triggered by an infection, but in sepsis, the immune system reacts very abnormally and starts to damage our own organs and tissues. And if we don't stop it, that can lead to death.
Is it hard to identify?
So look, we're not going to pretend that this is easy to identify. It can arise in people of any age, as we've just heard. It can arise as a consequence of infection anywhere in the body. So no two people with sepsis present the same. Getting this right demands that the public are empowered to ask, could it be sepsis? And that health professionals work in a culture and are well trained to think sepsis.
What are your tips for identifying it?
So to members of the public who are worried about themselves or a loved one, the first thing is trust your instinct. You know what you or a loved one look like when they have an infection normally. If something doesn't feel right, if something looks very much worse than normal, then go to 111 or go to see the GP and just ask, could it be sepsis? If you're really worried, there are 6 key symptoms which spell the word sepsis. S for slurred speech or confusion, E for extreme pain in the muscles or joints, P for passing no urine, no water in a day, S for severe breathlessness, I for it feels like I'm going to die, and people say that repeatedly, and the final S for skin that's mottled, discoloured or very pale. Any one of those 6, they're available on our website, go straight to A&E. Not tomorrow morning, right now.
Is it common?
Alarmingly so. There are more admissions to British hospitals with sepsis than there are admissions with heart attack. It claims more lives than most of the major cancers. So this is almost 250,000 of our population every single year. I think we're done with pretending that this is a rare condition. This is frighteningly common.
What needs to happen that isn't happening yet?
So we had a commissioning incentive across the NHS running from 2016 to 2019, and our performance improved. And actually, there's some evidence that more people survived as a consequence. We need to get back to that. We need to invest in better sepsis care. There's a mechanism called a best practice tariff that would help to achieve that and also help to deliver better use of antibiotics to slow the spread of antimicrobial resistance.
And just finally, in terms of in hospitals it being identified, do you have sympathy with when it gets missed? Is that something that sadly can happen, or is it really and truly unacceptable?
So I absolutely do have sympathy, and it's very difficult to ever criticise a health professional for failing to spot it at one encounter with a patient. This is about changing systems. It's about making sure that people don't fall through the gaps. If you think about a GP will see probably thousands of children with fever every single year. They might see one child with sepsis. So it is in some ways, it's a needle in a haystack, but that doesn't mean we shouldn't look for it. We've got to be in the ball.
Dr. Daniels, thanks so much for joining us.